A 58-year-old man with chronic obstructive pulmonary disease presents to the clinic with a 2-day history of fever, malaise, and a dry cough. On examination, his temperature is 38.4 degrees Celsius, 101.1 degrees Fahrenheit, pulse is 96 per minute, respirations are 18 per minute, blood pressure is 138 over 82 millimeters mercury. Rapid influenza test is positive for influenza B virus. He is started on an antiviral medication that targets a viral enzyme required for detaching newly formed virions from host cells. Which step of the viral life cycle is most likely inhibited by this medication? Choice A, viral entry via fusion with host membrane. Choice B, viral RNA transcription. Choice C, processing of viral proteins. Choice D, release of new viral particles. Or choice E, integration of viral DNA into host genome. Only 5 seconds in answering the question. So, very straightforward question actually. This patient has influenza B, and as far as USMLE goes, the most relevant treatment you have for influenza B is neuraminidase inhibitors, mostly oseltamivir. Zanamivir is another one you might hear of once in a while. Point is, both of them inhibit neuraminidase and prevent the release of new viral particles from the host cells, so choice D is the correct answer. Again, not much to say here. This is one of those things where you just gotta know the mechanism of oseltamivir. So let's look at some of the other answer choices because some of them actually do represent some other high-yield antivirals for USMLE. Choice A, viral entry via fusion with host membrane. This one isn't super high yield, but it can be talking about enfuvirtide, which is an HIV drug which blocks GP41-mediated fusion with the T-cell membranes. So obviously HIV entry into the T-cell. It can actually also describe amantadine and rimantadine, which are also influenza drugs which block M2 channels and prevent viral uncoating. But notably, because this question was asking about influenza B, you would not use amantadine for that. Amantadine is more used for influenza A. Amantadine is also used for Parkinson's disease because it has some dopamine-related effects. It increases dopamine release and decreases dopamine reuptake. But honestly, amantadine is a pretty low-yield drug in general. I would say no about it, but obviously don't emphasize it as much as something like oseltamivir. Choice B, viral RNA transcription. It's going to refer to a lot of things, but first thing I would think of is ribavirin, which is a broad-spectrum antiviral. Choice C, processing of viral proteins. This actually can be very high yield if you're talking about HIV protease inhibitors, which are the Navir drugs, like ritonavir. HIV drugs in general are pretty high yield. I guess another thing worth noting here is that ritonavir is a P450 inhibitor. That comes up once in a while. Choice E, integration of viral DNA into host genome. Again, this can refer to some HIV drugs, in this case the integrase inhibitors, which are the Gravir drugs like raltegravir. The integrase inhibitors can cause elevated creatine kinase. I think it's more important that you just generally know that if you see an HIV drug with a Gravir in the name, that it's an integrase inhibitor. So bring it back, oseltamivir has been tested on a few times. It's a neuraminidase inhibitor, and it prevents the release of new viral particles. Hope this video was helpful. I'll see you in the next one.